Tensioner application is an important part of the ARTAS harvesting procedure. The XTensioner ensures that the skin maintains enough tension in the current area of harvesting. After being applied to the scalp, the flexures at the corners pull the skin toward the sides of the XTensioner. The elastic tubing reminds the patient to refrain from excessive motion and holds the XTensioner against the patient's scalp. There are also fiducial markings on the XTensioner that are used to track dissection locations during the harvesting procedure. The XTensioner tool is used to apply the XTensioner to the scalp. The tool is used to compress and pick up the tensioner, and then to transfer it between a chosen grid location in the donor area and the XTensioner tray. When not affixed to the patient's scalp, the XTensioner is stored in the tray to prevent damage to the pins. The tool may also be stored with the XTensioner using the tray in between grids. The XTensioner is such an important step in the harvesting procedure. Let's review how to properly apply the tensioner, check the application, and correct if needed. When placing the tensioner, it is recommended that the physician has someone assisting them. Using the tool, align the tabs of the XTensioner with the grooves of the tool. Compress to engage the lock of the XTensioner tool and pick the tensioner up from the tray. Position yourself at the head of the patient to apply the tensioner to the donor area. Using your free hand, manually stretch the skin superiorly. The physician's assistant should then stretch the skin laterally. Fully compress the XTensioner using the tool. With even pressure, apply the XTensioner to the scalp. Using your free hand, press the XTensioner pins into the skin and hold the tensioner in place. Release the lock on the XTensioner tool using the release lever. Keeping even pressure on the XTensioner, apply a slight superior pull on the tensioner and attach the straps to the slots in the halo. The superior straps of the XTensioner should be locked in first. The strap should be locked into the adjacent slot in the halo. To prevent damage to the tensioner straps, do not pull on the straps once they are secured into the slots on the halo. With the XTensioner applied and secured to the halo, verify that the application is adequate for the harvesting procedure. First, ensure the pins remain engaged with the scalp and are not lifting. Next, check for skin blanching in the center of the tensioner. The tissue within the tensioner should appear pale compared to the tissue outside the tensioner. Check the firmness of the tissue within the tensioner. The tissue should feel taut compared to the tissue outside of the tensioner. Finally, check for superior movement of the tensioner. Using a finger on the bottom edge of the tensioner, push superiorly. There should be little to no movement of the tensioner. To maintain consistent graft quality, inject Tumescent into the corners of each grid. There should be no more than 2 cc per grid or 0.5 cc per corner of solution injected. At times, the tensioner application may need correction. If the pins are lifting from the tissue at the corners, moving the tensioner straps from the top halo to the bottom halo may help this. If the tissue lacks firmness, ensure Tumescent was injected into the grid as discussed previously. If there is excessive superior movement of the tensioner, readjust the superior straps. Hold the tensioner with one hand and pull upward. Release and adjust one superior strap at a time. Place the straps more forward to lock the tensioner in place and reduce movement. Recheck your tensioner application. If it is still not adequate, remove the tensioner and reapply. Proper grid overlap when applying the XTensioner is important to prevent gaps in the donor area. When placing the XTensioner, there should be approximately 2 visible rows of previously harvested sites to prevent these gaps. At the end of each harvesting grid, the XTensioner should be removed and prepared to place in the next grid location. To remove the tensioner, align the tabs of the XTensioner with the tool. Compress the tool to engage the lock and release the straps from the halo. Fully compress the tool and lift the tensioner from the patient's scalp using the tool. Place the tool and tensioner in the tray until ready to apply the next grid.